Hi, I'm Corey Stahley, board-certified pediatric dentist and owner of Grin Grow Pediatric Dentistry in Cypress, Texas. New Smile brought the SOAN to pediatric dentistry, and I've been using it the past 2 years. I'm really excited to explore the next steps to resolve some of the limitations that the SOAN has. The QuickSleeper is something I'd heard about, and I was super excited to try it when it finally came out. So previously, my schedule with pediatric dentistry used to involve going into an op, numbing, and then leaving and going to do 2 to 3 exams to wait for that local anesthetic to kick in. With intraosseous anesthesia, you get instant anesthesia, so you don't have to get up. You can finish your treatment and then send the kid on their way, go out and do exams, so it's more personalized care. Not to mention, when we're using this technology, it's a painless injection. Also, the post-op care is a lot easier. The post-op care is a lot more pleasant for the patient. Less collateral numbness, the anesthesia wears off at a faster rate so they can go on their day with no interruptions. The QuickSleeper is painless, instant onset, and no collateral numbness, so you can get to work right away. The QuickSleeper allows us to see patients of any age, so it was a no-brainer for me. The SOAN works great for our patients and friends about 2 to 10. Anytime we would start to work on permanent teeth, sometimes the SOAN struggles, the QuickSleeper is the perfect solution to that. Painless anesthesia, and you get to work right away. So why buy the QuickSleeper5 if I already have a SOAN? That's a great question, but the main issue we run into with the SOAN is doing permanent teeth on our teenagers to young adults. The QuickSleeper5 is a great solution to that. As a pediatric dentist, some of the most difficult cases we run into are teens and young adults. A large 18OB, 15OL, the SOAN used to struggle with that, but the QuickSleeper makes it a breeze. That's exactly why the QuickSleeper has become standard of care for me. I love my SOAN, and I'll still use it here and there for the young, anxious patients, about 6 and under, but the QuickSleeper really allows me to use one device for all the other patients. I've definitely had a head start ever since using the SOAN since it first came out. If you're familiar with the SOAN, the initial injection and the angulation is all the same thing, so super easy to pick up. For those that don't have a SOAN or haven't started or hopped on board, the QuickSleeper is an answer to all those problems. You can see the young kiddos use it like the SOAN, or you can see the kiddos all the way up to teens and in colleges. The QuickSleeper is definitely a tool that I can't practice without. It was one of the first investments that I made coming into practice just because it makes my life so simple. The QuickSleeper has made dentistry easy for me, for all patients.